I'm Tamanna Inamdar. Welcome to The Big Question, a new show on NDTV Profit where we discuss the most pertinent questions relevant to you. Questions that impact your life, your well-being, your wallet, and of course, our country. We aim to cut out the noise and get you well thought out views from the top experts in the field. We hope to explain what's actually going on instead of just throwing clickbait headlines at you. With that, let's begin our first show. 5 years after the world was left shaken by the COVID-19 pandemic, which claimed millions of lives and brought economies to a standstill, reports of another such airborne respiratory virus in China, the HMPV or the human metapneumovirus, has raised an alarm again. Now in India, concerns have further heightened today as we have confirmed the first 2 cases of the HMPV virus. 2 infants from Bengaluru have tested positive for the virus, a 3-month-old baby and another 8-month-old baby. Now, neither of these infants have had a history of international travel. According to the Ministry of Health and Family Welfare, both cases were identified through routine surveillance for multiple respiratory viral pathogens as part of ICMR's ongoing efforts to monitor respiratory illnesses across the country. As a precaution, surveillance has ramped up across several states. Delhi, Maharashtra, Telangana, other state governments have also issued guidelines to ensure preparedness for potential health challenges related to HMPV and other respiratory viruses. Meanwhile, China has tried to downplay the concerns regarding the virus and has called it a regular occurrence during winters. It has further dismissed concerns over travel to China, saying that the country is safe for foreign travel. The big question that we're asking today, one that I'm sure is on everyone's mind, is are we in for another global pandemic-like situation, and how worried should we be? To speak on this, I'm joined now by Dr. Rakesh Verma, Principal Consultant at the Ministry of Health. Dr. Verma, thank you so much for speaking with us today on The Big Question. Let me pose that directly to you. How worried should we be about this new virus? First of all, is this as easily spreadable? Is it as infectious as COVID-19? Is it as dangerous as COVID-19? And I'll just add one more. What we're reading is that this HMPV virus is not new, it's been around. So why are we talking about it right now?
See, there are 2 kinds of virus. This is an RNA virus, which mutates, which shape changes it like a cricket, like a spider. It keeps on changing its fabric and profile. So this is which mutates very fast. It changes itself very fast. Just like movie films, heroes, heroines, stars. They keep on changing their dresses very fast. You can't recognize them. There are certain movies, one hero plays 7 roles, 11 roles, 12 roles. So this is a virus which is A shape today, could be A plus shape tomorrow, could be C shape tomorrow, and could have the changing properties. So that is the most dangerous thing. Yes, you are correct. It also spreads with the oral cavity, with the respiration. So with every cough, with every sneezing, an infected person can inflict the same disease to several people within a spectrum of 6 meters. That's why they say that we have to follow the same precaution. Now, considering whether it is the same prevalent or same dangerous, the news from China is still very much restricted and is very much censored. But whatever we presume, yes, this could be as lethal as COVID virus was, because both belong to the same family. Third, your query was whether this virus was available or prevalent. Yes, it was prevalent, but not in that, it did not have that many pangs. Just like we have so many snakes around us, but all snakes are not dangerous. There could be natural snakes. Only certain type of snakes could be more dangerous. So while the virus was present in the atmosphere, but the current mutation is seemingly very dangerous, could be causing lethal.
Okay, let me come to that part because you're explaining this very well. You're saying that the current mutation of this virus, which has been around, is giving a bit of concern. The concern, once again, like it was last time, I'm sorry to say, is because not enough information coming in from China, and the information that's coming in, honestly, we don't know if we can trust. So that is the concern.
Information from the origin country was kept secret for months and years together. Until today, we do not know what was the actual beginning of it, how it spread. And whether it came from a laboratory or from a fox market or from meat market, we do not know exactly. Whatever tailored information that we get, we were trying to work on that information. So even now there's an epidemic in that country and the information is very well restricted. As a doctors also, we got limited channels to know, but whatever we come to know, it's not encouraging knowledge. We are getting scared, and possibly government must be taking all steps to keep its hospitals, its medical facilities ready for any such exigencies.
Okay, so what is the treatment and is there a vaccine?
See, as of now, the treatment is the treatment of the symptoms. There is no direct medicine for killing that virus. We are treating only as and when the patient will come, we will treat the patient's fever, patient's symptoms, sneezing, cold and things. But there is no vaccine as of now available because we do not know which virus is there. We do not know what is affecting, what mutant is affecting. But as and when our laboratories are ready, they are geared up already, they are already making preparations. As and when we get the samples, possibly the vaccine development process will immediately initiate and do something good for the country.
And what is the testing mechanism we have right now? Can you tell quickly enough?
We were testing the throat swab, nasal swabs, and there's something known as PCR or multiplex PCR test, which will be required. Those tests are available in our country, but making them more specific for this virus is time will tell. We have to modify our test according to those viruses.
Okay, so just last point, Dr. Verma, is now what do people do? We all know the basic precautions of staying away from someone who has a cold, etc.
Remember all the same thing, irrespective of virus, irrespective of this virus or any other virus, we must maintain a social distance. Do not go to a crowded place. Avoid markets. If somebody is coughing and sneezing, request him to be alone, go away, use mask or use big towel while sneezing or coughing. One should not hesitate. And when you're going in public, especially train travel, bus travel or aeroplane travel, please use a mask. Do not hesitate in using a mask and keep a mask as close as you're keeping a handkerchief in the pocket and never hesitate. And avoid going into public where it is avoidable. And when you're going to public, do not hesitate if the hands are dirty or shake a hand with somebody or use your door handle which other people are also using. Do not hesitate in cleaning your hands with a good soap. Do not require a sanitizer always. A good quality soap will always be enough for sanitizing you and keeping you free from all these viruses.
Okay. So what we can hope is that as a people, as a nation, as a medical system, we have learnt our lessons and definitely we'll be better prepared.
I can only assure you that we are fully geared up. The government is fully geared up and government at the highest level always looking 4 steps forward. And last time also our Honorable Prime Minister was monitoring the COVID situation, and this time would not be at any different. But we don't want an epidemic. We certainly don't want an epidemic. We want to nip in the bud. And maybe that this is the only isolated case and doesn't convert into a pandemic.
All right. So we have to hope for the best. Thank you so much, Dr. Verma, for speaking with us today.